Medical ethics plays a crucial role within the medical profession. As a result, they are commonly included in medical school interview questions, medical university examinations, and professional examinations. In this video, I'll give you the tips for the introduction of medical ethics, including significant references to enhance your understanding. The 4 principles of medical ethics are justice, autonomy, non-maleficence, and beneficence. My memorix is JAMB, J-A-M-B. I will introduce one by one from B first. According to World Medical Association International Code of Medical Ethics, beneficence, the physician must offer care in the patient's best interests. Non-maleficence, also known as do no harm, the physician must strive to prevent or minimize harm for the patient. In fact, beneficence and non-maleficence can be traced back to the time of Hippocrates. In the text of the Hippocratic Oath, I swear that I will follow that system of regimen which, according to my ability and judgment, I consider for the benefit of my patients and abstain from whatever is deleterious and mischievous. The physician must seek a positive balance between the intended benefits to the patient and any potential harm. What is in the best interest of a person? In Hong Kong law, Cap 136 Mental Health Ordinance, in relation to carrying out of treatment, means in the best interests of that person in order to A. Save the life of the person. B. Prevent damage or deterioration to the physical or mental health and well-being of that person. Or C. Bring about an improvement in the physical or mental health and well-being of that person. Then A. Autonomy. Autonomy was affirmed in a court decision by Justice Cardozo in 1914 with the dictum, every human being of adult years and sound mind has a right to determine what shall be done with his own body. I would like to use this as a definition of autonomy. Autonomy, as is true for all 4 principles, needs to be weighed against other ethical principles. An obvious example would be if the autonomous action of a patient cause harm to another person. In addition, autonomy in some instances can be overridden. For example, minor mental or physical conditions affecting the sound mind and the right. In the upcoming videos of level 2 or above, I will furnish you with additional details concerning the overridden scenario in autonomy. J. Justice. Justice is the fair treatment of people, the condition of being morally correct or fair, the system of laws in a country that judges and punishes people. Example, you are a doctor working in a hospital. A middle-aged patient had severe bleeding following road traffic accident, requiring a blood transfusion. However, the patient refused the transfusion due to religious belief. In this scenario, there are conflicts between the medical ethics principles. For the best interest, blood transfusion can bring about an improvement in the physical health and well-being of the patient. On the other hand, the autonomy of the patient should be respected if the patient refuses the transfusion due to religious belief. Here, autonomy prevails over beneficence. Recommendations for further reading. An article in 2021, Principles of Clinical Ethics and Their Application to Practice. Chan tips. The 4 principles of medical ethics are justice, autonomy, non-maleficence, and beneficence. My memorix is JANB. Remember the definitions of the 4 principles. Beneficence is to act for patient's best interest. Non-maleficence means that do no harm to the patient. Autonomy. Every human being of adult years and sound mind has a right to determine what shall be done with his own body. Justice is about the fair treatment of people and the laws. This video is for the introduction of medical ethics, including references to enhance your understanding. In the coming levels, I will demonstrate a deeper understanding of the 4 principles, present illustrative cases, and showcase examination skills. Thank you.